Let's tell you about President Cyril Ramaphosa hoping that the National Health Insurance Bill will soon be finalized and benefit all South Africans. The bill, which is currently before Parliament, seeks to allow every South African healthcare access regardless of the ability to pay. There's mounting criticism, though, in terms of the delay in the implementation and adoption of the bill. We're now joined by Dr. Sibongiseni Dhlomo. He's the Deputy Health Minister. Thank you very much, Dr. Dhlomo, for your time this afternoon. Maybe let's start with where we sit in terms of the NHI becoming a reality in South Africa. How far are we in terms of Parliament wrapping up its work and adopting the bill?
Thank you very much, ma'am, and good day to your viewers. I'm in Cape Town now. I've just come out of the Portfolio Committee of Health that is deliberating on this process. In fact, they are considering two opinions that came in from the state law advisor and the legal representation of Parliament. They've already listened to all submissions. You'll recall I was still a chairperson in 2019 when we received the bill in Parliament and went through the country listening to all our South Africans, what they had to say about the bill. We then later had about 200 institutions that came to present to Parliament. Then I left the process then to become the Deputy Minister. But I'm still very interested, as I'm saying today, I was in the Portfolio Committee. So they are almost wrapping up within the Portfolio Committee of Health in the National Assembly. That bill will then go into the House for debate and therefore hopefully for adoption and be sent to NCOP for concurrence. We really do not have enough time, as this bill came into the sixth administration as early as when we just got elected in 2019. Really within the next 12 months we'll be exiting as parliamentarians from this process. We should get this bill really getting into the ground. You are correct, South Africans are waiting out there, but you had to work through all the legal processes. We already are very much keen to see this bill out because, in the early democracy, President Nelson Mandela introduced part of what we call the bill. By the mere getting the under 5 children to be on treatment, to be seen in clinics without any payments, all pregnant mothers to visit our clinics and hospitals without any payment. This now is bigger than that. We are getting all citizens to be benefiting. So this is why we say some aspects of this have already been tasted by South Africans, but we now want it to pick up the whole population to benefit.
Dr. Dhlomo, you mentioned that two opinions are being heard by the Committee on Health. What are the arguments there, or what are their positions, these two opinions from where?
You'd recall the state law advisor, even before tabling, when I was still a chairperson, we asked this. As a portfolio committee, we understand this bill comes from cabinet. This is what the minister is requesting. But state law advisor, come and advise us. What are the things that you see on this bill which probably may be giving us certain issues that may be unconstitutional or whatever that is your comment? So we're very comfortable because when we started with that, we then received that legal opinion. Of course, there have been certain issues of concern raised by the legal representation. Just to pick one is to say we seem to be narrowing on the bill the health services that are available to the children of asylum seekers, the asylum seekers and all that. And therefore, those are things that are being tidied up. But we don't think it is going to really take longer than 3 weeks before the Portfolio Committee finalizes this process and hand it over into the House. So we are comfortable that all legal processes that are being tidied up now are really to enable and to allow, as the President was speaking yesterday, to see this public good, this actually program that is going to benefit me and you and all South Africans without really getting into the financial health risk, but benefiting really. It really removes the risk financially for seeking health services in the country.
Dr. Dhlomo, you also mentioned that public consultations took place. What is it rather that you heard from members of the public in terms of either supporting or having concerns where this bill being adopted is concerned? You take a look at the Health Ombuds report just last week in terms of Rahima Musa Mother and Child Hospital, painting a less than desirable picture, and we're talking about pregnant women. Charlotte Maxeke Hospital, we understand, has a shortage of medical instruments, and that's just to highlight but two of many issues that plague our public hospitals in the country.
On the public hearings that we conducted, the overwhelming views were in support of the national insurance, the universal health coverage. And there were also certain variations like please, but can you improve? If you are saying the national health insurance talks to improving the primary health care and giving us a primary care approach, can you improve the facilities around where we live? If the point of the referral pattern is going to say, I started the clinic next to me before I go to a bigger hospital. So those concerns, that is what the department should be doing. And there's a good guide. The Presidential Health Compact is a document that was developed in 2018 that outlines the real serious shortcomings the department must deal with, among others, infrastructure, the filling in of vacancies, our real slow process in terms of getting into the IT space, and the availability of medicines and all those. So that's a package, and also there's on the Office of the Health Standard Compliance, as we are referring to, a particular standard of expectations of how a facility should be run and how it should look like. And therefore, those are things that we are saying, us as a Department of Health are the enablers for the department to really move in easily within NHI. So those things we are very mindful that please improve on these enablers that are going to see this process going on. Of course, there were some of the issues that were few concerns saying we don't need a universal health coverage now. NHI, who is going to pay for it? Where is the money going to come for it? But it was probably like me and you who already are benefiting from a huge subsidy from the government, especially for those who are civil servants and us in the public representative. We get a huge benefit of a 25 billion subsidizing my medical aid on top of what I give. That 25 billion is not available to my domestic worker, to my grandmother, and to any other person, to any other South African out there. So the money should be there, and it is there already to start kicking off the NHI process and creating the big fund for all of us.
What is the submission of medical insurance scheme or medical aid schemes?
The medical insurance schemes are saying, we are saying there would be a process, and there are probably some of them are agreeing that they will not be eliminated. If you and me would want to continuously have a medical aid scheme, which maybe has been what is there all over the world when such processes are starting, you then should have it if you so wish. But it should be complementary. There will be an expectation from me and you that we contribute first to this initial fund that is going to actually help every citizen, including my gardener, my domestic worker, to access health just like me. But if I then want to maybe don't want to jump the queue, don't go to the referral pattern as put in there, or I want to have what will not become from the comprehensive health package, I want maybe to go and to do liposuction or doing other things, then you still can have your medical aid to take care of those other things that may not be covered within the comprehensive health package. But you would still have to pay anyway. With maturing universal health coverage worldwide, there's then a gradual no need to have a medical aid scheme separately from contributing to this fund. But initially, some of the citizens might prefer to keep their medical aid, which is fine, but you would have contributed anyway. First package of contribution is to this universal health fund that must assist all citizens in the country.
When you say contribute, what does that mean? How much?
We will contribute according to what we earn and what we do have as a company. Those final details have not been actually finalized. All that we are saying that there will be an NHI fund that citizens of the country who are working will contribute, and probably to the monetary policy, the monetary part of it will be refined by our National Treasury together with the Department of Health and other aspects as to where should that money come from. Should it come from all of it from fiscus, or there should be some contribution from the members who work? Those details will come in. All we are saying that for this to happen, we should not be disadvantaging citizens who are not working, who are not able to provide for health services, and say the health is a public good for only those who are having monies in their pockets. It should be a public good for all citizens. So what are we creating here? A social solidarity, a program that is going to take everybody into equal access to health services, irrespective of their socioeconomic status.
Sure. Dr. Dhlomo, if I may, I'm not sure if you are aware, but in Tanzania there's apparently a mysterious virus or disease that is doing the rounds, and I saw a report this morning of a similar mysterious disease doing the rounds. I think it's in the United States. I stand to be corrected. Is this something that our health department or our scientists have picked up, and is there cause for concern? We saw what happened with COVID-19, and now we've got, 2 countries reporting of mysterious diseases? Unfortunately, we have lost our connection with the Deputy Health Minister, Dr. Sibongiseni Dhlomo. We'll try and get an answer to that question a little bit later on. For now, though, let's